Activity and Exercise Part 1. Mobility is necessary for all aspects of life. Excuse me. A decline in a client's mobility can result in health problems. Clients that have acute and chronic illnesses, injuries, or surgery are going to experience periods of immobilization. Factors contributing to the client's immobility will include the length of stay, the severity of the illness, their emotional status, and their physical condition. An overview of exercise and activity. If you do not practice proper body mechanics and principles, both the client and the nurse can be injured. Correct alignment will involve positions so no excessive strain is placed on a person's joints, tendons, ligaments, or muscles. Proper balance requires the least muscular work to maintain and places the least strain on muscles, ligaments, and bones. And coordinated body movement is going to help prevent stumbles and falls. Infants through school-age children. The newborn infant spine is naturally flexed and it lacks the anteroposterior curves that the adult normally has. The toddler's position is pretty awkward because they have a little bit of a sway back and a protruding abdomen. Then as they continue to age from the 3rd through the 12th years, the musculoskeletal system will continue to form and develop. They gain greater coordination that enables the child to perform tasks that require fine motor skills. Adolescence growth is very uneven and movements are often seen as uncoordinated as they tend to grow into their bodies. Young to middle adults, adults that have posture and body alignment has the necessary musculoskeletal development and coordination needed to perform their ADLs. And older adults suffer from progressive loss of total bone mass. Clients may be more likely to include an exercise program if they have some support from home, family, friends, and their healthcare providers. Environmental issues such as the work site can be viewed as a barrier to performing a daily exercise program. We know that a healthy work environment will create healthier and more productive workers. And there are some communities and schools that encourage and help initiate exercise programs. It's important for the nurses to identify any cultural or ethnic influences the client may have. For example, knowing that a specific disease entity may have cultural or ethnic origins enables the nurse to develop a culturally competent exercise program. As the family or social support group offers motivation to the client, they're going to be more apt to participate and stay loyal to an exercise program. The skeletal system provides support, protection, leverage for movement, mineral storage, and blood cell formation. Joints connect bones to bones. Ligaments, tendons, and cartilage will bind joints, connect bones and cartilage. It can also act as shock absorbers between articulating bones. Skeletal muscle will connect muscles to bones, and they determine the body's form and contour. Muscles that are concerned with movement, coordination and regulation of muscle groups depend on muscle tone. The activity of the antagonistic, synergistic, and anti-gravity muscles, and neural input to muscles. Muscles that are concerned with posture are the muscles of the lower extremities, the trunk, neck, and back. Muscle tone is the normal state of balanced muscle tension, and it's achieved by alternating contraction and relaxation without active movement of neighboring fibers of a specific muscle group. The nervous system. Motor fibers from the right motor strip initiate voluntary movement for the left side of the body, and motor fibers from the left motor strip initiate voluntary movement for the right side of the body. Movement is regulated in the voluntary motor area in the cerebral cortex. Neurotransmitters transfer electrical impulses from the nerve across the neuromuscular junction to the muscle itself. Proprioception is the awareness of the position of the body and its parts. And balance is controlled by the cerebellum and the inner ear. You need to be aware of whether the client can or cannot help you, and you need to prepare for assistance if the client is not able to help. Make sure you have enough assistance. Pathological influences on alignment can be caused from congenital defects, disorders of bone, joint, and muscle, CNS damage, and musculoskeletal trauma. And it affects the efficiency of the musculoskeletal system in regard to alignment, balance, and appearance. Disorders of the bone, joints, and muscles can include osteoporosis, osteomalacia, inflammatory and non-inflammatory joint disease, and articular disruption. Damage to any part of the central nervous system that regulates voluntary movement can cause impaired body alignment and immobility. Musculoskeletal damage will include bruises, contusion, sprains, and fractures. Congenital defects affect the efficiency of the musculoskeletal system in regard to, I've already said that. So let's move on to the next slide. Metabolic systemic effects of immobility are going to be included with the endocrine, calcium absorption, and GI function. We see respiratory effects with atelectasis and hypostatic pneumonia. With the cardiovascular, we can see orthostatic hypotension and thrombus formation. Musculoskeletal changes include loss of endurance and muscle mass, and decreased stability and balance. Muscle effects that are seen with immobility means a loss of muscle mass and muscle atrophy. Skeletal effects will be impaired calcium absorption and joint abnormalities. Urinary elimination would be urinary stasis or renal calculi. And integumentary would be pressure ulcers and ischemia. Clients who are immobile are at risk for the disuse syndrome, which is a multi-system problem or multi-system problems that are caused because of inactivity. Prolonged bed rest is going to increase the heart's workload and produces an increase in oxygen demand. Immobility can lead to joint contracture, which is characterized by an abnormal fixation of a joint. Immobility presents hazards in the physiological, psychological, and developmental dimensions. The risks of disabilities related to immobilization depend on the extent and duration of immobilization and the client's overall level of health. When the client is immobile, the body often will excrete more nitrogen than it ingests protein. And this is going to cause a negative nitrogen balance that leads to weight loss, decreased muscle mass, and weakness resulting from tissue breakdown or catabolism. Lack of movement and exercise will place clients at a higher risk for respiratory complications. Clients who are immobile are at high risk for developing pulmonary problems. The most common respiratory complications are atelectasis, which are collapse of the alveoli, and hypostatic pneumonia, which is inflammation of the lung from stasis or pooling of secretions. Again, the cardiovascular changes, the heart is having to work harder and the blood is not flowing as well. Excuse me, so the potential for blood clots to form is greatly increased. The patient will lose lean body mass due to protein breakdown, and this also results in increased fatigue, muscle weakness, and atrophy. With the skeletal effects, the changes come about because of calcium metabolism and joint abnormalities. The disuse osteoporosis is due to bone resorption. And then we see joint contracture. Renal calculi are going to be basically kidney stones. They may be located in the bladder, having passed through the ureters, or they may be in the kidney. These are usually made of calcium, and they're caused by hypercalcemia or concentrated urine because of dehydration. And we also see infection because of catheters or inappropriate perineal care. Pressure ulcers are characterized initially by inflammation, and then we often see these formed over bony prominences. Ischemia develops when pressure on the skin is greater than the pressure inside the small peripheral blood vessels supplying blood to the skin. Older adults are always at an increased risk for pressure ulcers. For an example, an older adult who is immobilized on a backboard after a trauma can begin to develop skin breakdown in just 3 hours. Emotional and behavioral responses include hostility, giddiness, fear, and anxiety. We may see altered sleep patterns because of immobility. Clients are now having difficulties with coping, and we see depression, sadness, and dejection. Immobilization changes the client's daily routine, and the client has more time to worry about their disability. Withdrawn clients often do not want to participate in their own care. Developmentally, we see the infant, toddler, and preschoolers with prolonged immobility having delayed gross motor skills, intellectual development, or musculoskeletal development. The adolescents will be delayed in gaining independence and in accomplishing the skills of their age group. And we also see social isolation. With adults, physiological systems are at risk, and we see changes in family and social structures. And then with the older adult, decreased physical activity, we see hormonal changes and bone resorption. Manually lifting and transferring clients contributes to the high incidence of work-related musculoskeletal problems and back injuries in nurses and other healthcare staff. There are algorithms out there for client handling and movement. These are assessment tools that guide safe client handling and movement. And then there's also an after-action review that uses findings from evidence-based nursing research about safe client handling to prevent injuries to nurses and clients when moving and transferring clients. Range of motion is the maximum amount of movement available at a joint in one of the 3 planes of the body: the sagittal, the transverse, or the frontal. To assess range of motion in a client, you have to ask questions about and then physically examine the client for any stiffness, pain, swelling, limited movement, or unequal movement. Range of motion exercises can be active, passive, or somewhere in between. Contractures can develop in joints that are not moved periodically through their full range of motion. We need to monitor clients for fatigue during exercise and assess the time required for recovery from fatigue. Body alignment is used for determining normal physical changes, identifying deviations in body alignment, client awareness of posture, identifying postural learning needs of patients, identifying trauma, muscle damage, or nerve dysfunction, and obtaining information on incorrect alignment, for example, fatigue, malnutrition, or psychological problems. Balance occurs when a wide base of support is present. The center of gravity falls within the base of support, and a vertical line falls from the center of gravity through the base of support. When you are positioning a patient, you need to make sure that their body is in correct body alignment. In other words, their spine should be straight, bony areas should be padded, and pillows placed wherever they need it for comfort.